Welcome to this educational video about one of the most important and advanced prenatal screening tools available today, the Non-Invasive Prenatal Test, commonly known as NIPT. This information will help you understand the role of NIPT in keeping both you and your baby safe. Make sure you subscribe to the channel and enable notifications so you never miss a new video. Let's begin. The Non-Invasive Prenatal Test, or NIPT, is a highly advanced blood test performed during pregnancy to screen for certain chromosomal abnormalities in the developing fetus. It is categorized as non-invasive because it requires only a simple blood sample from the mother, without any physical intrusion into the uterus. There are no needles going near the baby, no pain other than a routine blood draw, and absolutely no risk to the pregnancy. This makes NIPT one of the safest and most accessible screening tools for expecting mothers. NIPT works by analyzing small pieces of fetal DNA, called cell-free DNA, that circulate naturally in the mother's bloodstream. During pregnancy, the placenta sheds fragments of genetic material into the mother's blood. These fragments contain valuable information about the baby's chromosomes. Using advanced sequencing technology, laboratories can study these small genetic pieces to determine whether there is an abnormal amount of DNA related to specific chromosomes. The test looks at patterns and quantities of DNA, and if too much or too little DNA from a particular chromosome is found, this may indicate a higher chance of certain chromosomal conditions. The most commonly screened disorders include Down syndrome, Trisomy 21, Edwards syndrome, Trisomy 18, and fetal syndrome, Trisomy 13. Some versions of the test can also detect sex-chromosome abnormalities, such as Turner syndrome, Klinefelter syndrome, and other variations like XXX or XYY. Depending on the lab, some extended NIPT tests may screen for microdeletions or small missing pieces of chromosomes, though these results can vary in accuracy. One of the biggest advantages of NIPT is its accuracy. For detecting Down syndrome, NIPT has an accuracy of more than 99%. For Edwards syndrome, accuracy ranges between 97 and 99%, and for fetal syndrome, accuracy is around 92%. These numbers make NIPT one of the safest and most accessible screening tools for expecting mothers. However, it is important to remember that NIPT is still considered a screening test, not a diagnostic one. This means it cannot give a definitive diagnosis. If the test shows a high-risk result, additional diagnostic procedures, such as amniocentesis or chorionic villus sampling, are needed to confirm the findings. The procedure itself is extremely simple. A healthcare provider draws a standard blood sample from your arm, just like any routine blood test. No fasting is required before the test, and no internal procedures are involved. The blood sample is then sent to a specialized genetic laboratory, where advanced analysis is performed on the cell-free fetal DNA. Results are typically available within 5 to 14 days, depending on the lab and the country. Once your results are ready, they will usually be categorized as either low risk or high risk. A low risk result means that the chance of chromosomal abnormalities is very small. It doesn't mean the chance is zero, but it is extremely reassuring and accurate. A high risk result means that there is an increased probability of an abnormality, but it does not mean the baby definitely has the condition. If you receive a high-risk result, your doctor may recommend further testing, detailed ultrasound examinations, or consultation with a genetic counselor. Despite its strengths, NIPT does have limitations. It cannot detect all genetic disorders. It does not screen for structural abnormalities such as heart defects or issues with the baby's organs. In some cases, the test may not work properly if the fetal DNA level in the mother's blood is too low, a situation known as low fetal fraction. Accuracy may also be lower in twin pregnancies or certain IVF pregnancies, depending on the technology used. It is also important to continue routine prenatal care, ultrasounds, and medical checkups because NIPT cannot replace these essential assessments. However, the benefits of NIPT are significant. It provides early, reliable information with no risk to the mother or baby. It reduces the need for invasive procedures, especially when results are low risk. It helps parents prepare emotionally, medically, and practically. It also allows doctors to monitor pregnancies more closely when there is a higher chance of complications. NIPT is an excellent option for women who want early reassurance or who have elevated risk factors. It has become widely available worldwide and is increasingly recommended as part of routine prenatal screening due to its safety and accuracy. Whether you are experiencing your first pregnancy or your third, understanding NIPT can give you peace of mind and help you make informed decisions about your baby's health. Thank you for watching this detailed video. If you found the information helpful, make sure to like the video, subscribe to the channel, and share it with others who might benefit. Your support helps us continue creating more educational content for expecting mothers.